You think it's your heart problem. You think it's anxiety. You think you are losing your mind. But it's not any of those things. It's your hormones, and nobody warned you about it. I am Dr. Mo, and today I'll be explaining exactly what changed the 10 weirdest perimenopausal symptoms that feels like something else is entirely wrong. Let's list them. Here's the thing. Women in their 40s go to their doctor saying, "My heart is racing at night. I can't remember anything. I feel like I'm a stranger in my body." And so they often get to hear, "It's just stress. You're just getting older." Every woman is different. And that is true. But you know that it becomes a way of avoiding what exactly is the truth and even looking close at that. So before we start, has anyone ever explained to you what perimenopause is about? Or did you have to figure it out by yourself? Comment below. I want to know, because today I'll be giving you the real answers. So let's start them. Racing heart and palpitation. Number 1. You know that some women end up in the emergency room, convinced that it's their heart, but often it isn't. During perimenopause, estrogen fluctuates and it can trigger adrenaline surges, and that actually makes your heart to pound, especially at night, and that also can happen during the hot flashes. You know that moment, my mamas, it can really feel terrifying, but often it's your hormones. Number 2, drenching in night sweat. Can you imagine waking up all soaked, like you actually ran a marathon in your sleep? You think it's fever or an infection. It's your body thermostat that is going haywire, all because of the dropping estrogen level. Very, very important. Night sweats are actually classic signs of perimenopause. What about the third one? Anxiety that just comes out from nowhere. You're fine, and suddenly, just all of a sudden, your chest tightens up, your mind starts rolling, and it's as if there's a mental health crisis. And you wonder, have I changed as a person? Actually, it can be your hormones spiking and dipping. That anxiety is real. I feel you, and I'm not dismissing that, but the cause might not be where you think. Hold on. I want to remember these 3 things, because these are the ones that actually send women to emergency room, and so often the heart is fine and the hormones are not fine. So let's go on. The 4th one is brain fog. Where are my mamas? You walk into a room and you forget why. You can't find the word that's on tip of your tongue, and you think, is this dementia? It's one of the most common perimenopausal symptoms. And you know, it's estrogen that is actually withdrawing and affecting your brain. It's real, it's frustrating, but it's not dementia. What's number 5? Mood swings and sudden surge of rage. You snap over every little thing. You cry at a commercial level. Even at simple commercial pain, you're crying. You think, I don't even recognize myself. Yeah, your hormones are driving it. It doesn't make it less real. But naming it actually helps to stop blaming yourself. Number 6, insomnia and weird dreams. Yeah, some weird dreams do happen. And what do? You fall asleep and fine. Then you're wide awake in the middle of the night and you're having the strangest, most vivid dreams. I feel you. It's not something you ate or something you did wrong. It's your progesterone that is dropping, and that affects your sleep architecture very, very well. Let's go on to number 7. Sudden belly fat and weight gain. Yes, you haven't changed anything, and yet the middle is growing. Estrogen and insulin resistance, they team up here, and it's not to just stop trying, it's hormonal. Number 8, digestion is slowing down. Yes, and that is why you cannot eat the same way as you used to. Bloating, quite very common. You think you've developed some form of abdominal distension overnight, but your gut, your GIT just slows down as the hormones shift. So bloating and constipation, they start creeping in, and very common, very under-discussed, even though a lot of women are passing through this. What's number 9? The random body aches. Your joints ache, your back hurts, and you think it's arthritis. Come on. Or you've overdone some things in the gym. It can be estrogen, and it affects your inflammation. Keep it on your radar and keep an eye on that. Number 10, erratic, heavy, endless period. Yes, you heard me. Periods that come whenever they want, heavier than before, or just never stops. This is a lot happening at the very same time. All these can happen simultaneously, not one leaving the other behind. And if your bleeding is very heavy or lasts too long, please don't push it through. Conventionally, we'll talk about hormone replacement therapy, and that has its place, and it should be discussed with your doctor. But you know that there's a piece that almost never gets to be discussed. So that's what lifestyle medicine actually adds to this conversation. Your symptoms, the response that your body has to every single day activities. So let's go through the pillars. Sleep, very, very important. Consistent, good quality sleep helps to regulate these hormones, and you can be sure that where your body does its repair is while you're sleeping. What about stress? Cortisol makes hot flashes and anxiety to actually get worsened. So finding even 10 minutes to cool down downshifts the matters and helps to resolve a lot of the symptoms. Movement is key. Regular movement, that is very important, especially strength training. You can't do without strength training at this period. It helps insulin resistance, and it helps the belly fat. How much more? It helps your mood. What do you put in your mouth? What do you eat? Talk about what your cycle is also going through. You know that what you eat talks to your cycle. Protein, fiber, healthy fat, they all help to support your blood sugar and your hormones. And then you know that none of this actually replaces medical care where it is needed, but is a part of the conversation you should actually have anytime you get to have this. Your cycle is one of the most sensitive indicators of what is happening in your body, and that means that you get to respond to changes that it actually makes with your body. Now, this is very important. These are not push-through symptoms, I can tell you that. If your bleeding is very heavy, if you're having severe pain, if that heart is actually racing and it doesn't settle down, contact your doctor. Go to the hospital immediately. Don't wait for an appointment. Very important. The goal is actually learning to read your body. What is your body talking to you about? But not just to dismiss it. If this helped you and you actually understand what is happening to your body now, instead of you just guessing, subscribe, hit that button, and I'll be covering every stage of women's health every week. Comment below which one of these body symptoms did you not get any idea of, or you were not warned about it. I'll be reading every one of your comments, one by one. Cheers.